Hi, it's Dr. Constance Scharf here, and I just wanted to talk with you today about Trump's the last few hours, pronouncement that in response to his panel or commission suggestion that we have a national emergency around the opioid crisis, that instead he's decided that we should focus on law enforcement to stem the tide of drugs coming into the country and build that wall. Now, we have 142 people, Americans, dying every single day on average in this country from opioid overdose. And we're looking at approximately 60,000 deaths from opioid overdose this year. Building a wall doesn't help that. So what does? Because we all know that Trump misses the point on opioid treatment and support. So what's the real solution? As an addiction researcher and as a specialist in addiction treatment, what we know is that it's treatment that helps people get off of substances, right? If addiction is a brain disorder, which is what we understand of it now, then the way to treat it is to treat the brain and the underlying psychological conditions that spurred the addictive use in the first place. When I was a kid, and I'm no longer a child, right? When I was a kid, we started the war on drugs, right? And we had, the Reagans and just say no, and this is your brain on drugs and all that business. And now more Americans are dying from overdoses than really ever before. So clearly that method doesn't work. If you want to save people who have a drug abuse problem, get them help. If someone you love has a substance abuse problem, I'm going to tell you straight, the federal government is not going to come to your aid. You need to start advocating at the state level for state healthcare exchanges that work. Senator Sanders is, in the next few weeks, he says, going to bring up a bipartisan bill, Medicaid for all. It is very unlikely that that would pass. Even if it passed in the Senate, very unlikely it would pass in the House, which means that the states are going to have to pick up the slack. If you want your loved ones to live, get them treatment and help the state find ways to do that. We all need access to health care. If someone you love needs treatment, reach out for help today. Take care of yourself.